Hello everyone. Welcome to Enzyme MBBS, where complex medicine becomes simple and exam ready. Okay, without wasting any time, let's get started. Coming to the introduction, wound healing by secondary intention is a form of tissue repair that occurs in large wounds with extensive tissue loss where the wound edges cannot be brought together. Okay, I hope it was very clear for you. Like here, there will be extensive tissue loss, so the wound edges are not in a position, so that's the reason it heals by secondary intention. So such wounds are commonly seen following trauma, infection, abscess drainage, burns, and ulcerations. In contrast to healing by first intention, healing by second intention is characterized by intense inflammation, abundant granulation tissue formation, significant wound contraction, and formation of a large scar. If you observe, in primary intention, there was very minimal inflammation, right, and minimal granulation tissue formation, but here both are increased, and there is very minimal wound contraction, but here there is significant wound contraction. We call it as contractures. If you have watched the complications of wounding, you would have came across that term. And formation of a large scar. There was a very minimal scar, but here large scar will be formed. So write the definition. Healing by secondary intention refers to the process of wound repair in which wound edges are widely separated. Okay, there was in a proper alignment, but here they are widely separated, resulting in healing by formation of extensive granulation tissue, marked angiogenesis, wound contraction, and prominent scarring. A straightforward definition. Then write the examples. So examples are large traumatic wounds, infected wounds, surgical wounds left open, burns, pressure ulcers, chronic non-healing ulcers. Remember, clean surgical incisions are example for primary intention, whereas surgical wounds left open are secondary intention. Then characteristic features. Now characteristic features, here there is extensive tissue loss, wound edges are not apposed, intense inflammatory response, abundant granulation tissue, prominent angiogenesis, significant wound contraction, large and irregular scar, prolonged healing time. All the things we discussed now. Then again, see, in the primary intention also I said, even in the secondary intention, the steps of the wound healing are same. The one which we discussed in the old video, that is process of wound healing. But while here you writing, do little modification, like when you are writing the inflammatory phase, right? There is intensive inflammation, more inflammation because maybe infection is present, all of that. And while writing epithelialization, right, there is more chance, more proliferation. And while writing wound contraction, do write like there is extensive contraction, contractures may happen, all this, because everything is exaggerated in secondary intention, because the wound size would be very large, right? So do all that, and just write that same thing. If you have not watched that video, please watch it. It will be helpful for you, and the exact same thing you are gonna write, because process of wound healing is same. It's gonna go through each phase, but the only difference is in the primary intention it will be minimal, and the responses are little low, whereas in secondary intention it is more. So that you have to modify accordingly. That's why we made the video on process of wound healing first. On basis of that, all these are discussed. Okay, so next write the tensile strength. Here little you have to vary, that is increases slowly and never reaches normal tissue, and usually lower than primary intention. And then clinical significance. So common in traumatic and infected wounds, healing is slower and more complicated, higher risk of infection, ulceration, contractures, and excessive scarring. Contractures is nothing but more contraction in wound, significant wound contraction, right? Yeah. And then, so hence it requires meticulous wound care. Meticulous means extreme care. You have to be very careful while treating this or monitoring this. Next, complications associated with secondary intention. It is delayed wound closure, chronic non-healing ulcers, hypertrophic scars, keloids. What are hypertrophic scars? What are keloids? Everything we have discussed in the complications of healing video. Okay, then contractures, that is especially seen after the burns, and exuberant granulation tissue. Exuberant is nothing but excess, right? Yeah, so that's all about this video. I hope this was helpful, and if it was helpful, please like and comment and show your support. So that's it for today. Thank you so much for listening.